Hi, this is Ayesha Akhtar with the Epilepsy Foundation of Greater Chicago. With me, I have Howard Zwirn. He's the chair of the Epilepsy Foundation of Greater Chicago. And I have Dr. Josh Rosenow. He is a professor at the Feinberg School of Medicine, as well as a neurosurgeon at Northwestern Medicine. And I wanted to welcome both of you to speak with me this afternoon.
Good
Thanks.
afternoon.
Happy to be here.
Thank you.
Yeah. So I think a lot of people know of you guys as a duo. And Dr. Rosenow, when I called Howard to ask him if he could join me for an interview, I think within 2 minutes your name came up. So you definitely go in pairs. But I think that really speaks to this wonderful relationship that you have created over the last 16 years. So Howard, I would love for you to share a little bit about how you met Dr. Rosenow. How did you come into his life?
Sure. Well, it's a pleasure. I came to meet Dr. Rosenow after several years of being diagnosed with epilepsy when I was around 28. I went through multiple different concentrations and types of medications. I was still having seizures, grand mal seizures and non-grand mal seizures. I went for a second opinion in the past. It was recommended that I had surgery, and my family and I were just too concerned about taking that next step, and so we had passed on it. My normal neurologist is at Northwestern as well, Dr. Sam Ho. Several years later, after having more seizures, it came to the point where he again suggested that I consider having surgery. And then following, I went in to take these follow-up tests that you have to do to see if you're a qualified candidate for surgery. I went through those tests, and I apparently passed very well, as they told my family. And that's when I first had the opportunity to meet Dr. Rosenow.
Awesome. So, Dr. Rosenow, from your point of view, why was Howard a perfect candidate for his procedure?
So, as Howard explained, he had persistent seizures despite taking, multiple drugs, both alone or in combination at good doses. And it's people like that that we start to consider whether or not they could be a surgical candidate. Obviously, not everybody with medication-resistant epilepsy is a surgical candidate, but given the positive results that we can see from surgery, it behooves us to at least offer that kind of an evaluation for everyone who's in that predicament. And as Howard said, after some reluctance to consider surgery, because it obviously is a big step, he went down that road, and he went down a very standard pathway of surgical evaluation involving multiple tests, including such things as coming in for an inpatient video EEG stay, things such as PET scans. I think, Howard, correct me if I'm wrong, you even had a WADA test.
I did.
I think he had a WADA test at the time because of where his epilepsy was, and he had very specific epilepsy protocol MRIs, and he had detailed neurocognitive testing. And after all of that, we felt that surgery was a very reasonable thing for him to consider. And we had multiple discussions with Howard and his family about how surgery would go, as well as the pros and cons of surgery and what recovery would look like, to give them all the information possible to make an informed decision.
So, surgery has changed so much, clearly, in the last 50 years. There have been so many advances. Do you think, still have that same notion of like a lobotomy, or are people now aware that there are so many different options, or is there just kind of like one size fits all? What would you say as far as the different avenues a person can go for epilepsy surgery?
Unfortunately, I think we're uh, affected by a compounding problem, meaning that I think that we've had this great fortune of all these really big advances in epilepsy surgery over the last 5 or 10 years. I mean, such that I don't know if Howard would have come into the practice now if we would choose this, if he would choose the same thing. I certainly think he might have different options, or at least a wider range of options than he had before. But we're taking a situation in which people were already underinformed as to the options that were available back when Howard had surgery and the benefits of that. And now we're adding all of these other options on top of it, which I still don't think people have a grasp that they even exist, let alone how beneficial they are. So the amount of kind of information lag is growing. And I think that's one of the things that we often look to partnering with the Epilepsy Foundation for, is helping to educate the public both on the advantages of aggressive treatment of seizures, as well as all these other advanced options that are out there. Because I don't know that a lot of the public really understands that epilepsy surgery is no longer about simply removing an area of the brain.
Yeah, that's really true. And I know that when I go into the classrooms and I talk about the different treatment options, and as soon as I mention that, 70% of all seizures can be treated by medication, but then there's 30% that cannot. And, these are the sort of menu of options that are available. Please speak to your epileptologist. A lot of times people first don't even know what an epileptologist is. So that's number one. But you said it right. People are very underinformed. There's a lot of lack of information, and there's so many new changes. And I love what you said, that if Howard had even come in the last 5 years, like who knows what would have been available. It just speaks to how quickly medicine is advancing. So I think that's really great. And I'm happy to help you in any way that we can at the foundation in spreading this information. And I know that I speak a lot in various different communities, but at least in the school community, can you talk a little bit about some of the different options that might be available for anyone under 18? Are there many options for that age group?
There certainly are. There's essentially the full range of epilepsy surgery is available for people in their teens, meaning there are, operations like what Howard had, which is, resection of a part of the brain that we believe is primarily responsible for the epilepsy. That's an operation that's done very often in the pediatric population, even down into very, very young kids. But now we have options that we've never had before that are less invasive, things like stereotactic laser ablation, or responsive neurostimulator placement, or deep brain stimulator placement, things that didn't exist several years ago even, in the form they're in now. And then there's still the mainstay of vagus nerve stimulation that also exists, and that's been around now for almost 30 years.
Yeah, that's one that I know a lot of kids in middle school and high school have definitely had, for sure. So Howard, how has this changed your life? Like, what is your day like now? What is your life like now? How are things different?
I mean, again, we never underinformed, and we never knew that really surgery was a candidate. And I've been trying to do what I can from Dr. Rosenow and other doctors and other hospitals, is to encourage it, and for people young and old to consider it, because what it's allowed me to do is, to a certain extent, cut off probably more than half of the medication that I was on, which again, my wife's mother had said, when I stopped that first medication, it was like I came out of a cloud. That was the first thing that she had said, and trying to get my life back to normal. And since that point, knock on wood, of day one, and it's been 16 years since I've had a seizure, is to really just begin where I was, nonstop every day, work all the time, 6-7 days a week, being very lucky to have our two girls that, at that point, we didn't have. Janine was pregnant with the first one, with Rachel. And I mean, my life, my memory, some people will say that they're concerned about losing memory when you go into that kind of surgery thing. And again, to me, the amount of the portion of the brain that's removed has had no impact on my memory. And Janine would attest that I can't use that as an excuse for forgetting things. Yeah, see, and Josh agrees with that. You can't use that as an excuse. And so my life has really begun and traveled so far in advance from what I am personally, business, traveling and everything, to where I was 16 years ago.
Wow. So Dr. Rosenow, what's it like for you? I know you've heard Howard's story several times. What's it like for you to hear that, whether it's Howard or another patient? I mean, it's got to make you feel like $1 million.
One of the wonderful things about working in a field like functional neurosurgery and epilepsy surgery are these kind of long-term relationships that we form with our patients. patients like Howard and my other epilepsy patients who we see time and time again as they go through their care, even if they're hopefully like Howard seizure free. It's so satisfying to see these changes in people's lives, where we have people who come back and say they never could have gotten a job with their continued seizures, or people who say I was afraid of getting pregnant because I was afraid of having a seizure, and having a small child at home. It's just so satisfying to see the amazing improvements in people's lives that we can affect by stopping their seizures. And Howard's a great example. This is someone who, really has used this opportunity to give back to the epilepsy community through his involvement. Howard's been a tremendous advocate for aggressive epilepsy care now for a decade and a half. And what better thing to see that, someone who, we helped then goes on to spread so much and help other people who were in the same situation.
It's so true. Yeah. I mean, it's been great. As long as I've been at the foundation, I've known Howard, and he's always been so supportive of my education efforts, particularly the consumer conference. That's the one that I put on. And you, Dr. Rosenow, you've spoken at that as well. So it's been great. So that's kind of like my personal mission, is I want to be able to help further your combined messages, and make sure that anyone who really needs to hear this message, anyone who's been diagnosed, really should know what all the options are. We put them all on the table. And as you mentioned, using the foundation as sort of that resource, I definitely find myself as a conduit of information and would like to share as much information as possible. But is there anything else that you think we can be doing, or any other message that you would like to share at this time? Either one of you.
Josh, I'll go for, I would just say that again, it was 15 years ago, we were very scared, right? We didn't know if it would help. We didn't know if it would work, right? We didn't know what would happen. Again, we just found out Janine was pregnant, and we went into this, that was a lot of risk. But with the trust in our doctors and taking on that trust, and again, 15 years ago, it's not like we have as much computer access and internet access to read about surgery and to read about all of the other great things that hospitals and doctors are doing. We didn't have that. And again, it was more a matter of just, two people talking to each other. And that's what we went with. And again, I think it's a tremendous opportunity for people to really consider and to really take advantage, because again, it doesn't help everyone, right? I'm very lucky, and we're very lucky. All of us are very lucky. And I think it's a great opportunity to continue to search and evaluate for everyone, from younger to people. I was, in my 20s, in my young 30s, right when this happened. And I think it's a great opportunity to look towards the future for. Josh.
Yeah, I can't agree more with Howard. Epilepsy surgery 2020 looks almost nothing like epilepsy surgery 2000. It's amazing to think that, but it's true. I think there are a lot of people in the past that may have had surgical evaluations that either scared them or who were told they weren't a candidate for surgery, who may be a candidate for surgery given these other treatments that we have. There are plenty of folks who in the past we wouldn't have evaluated for surgery, or we would have evaluated and then not offered them surgery, who now go through and have procedures and are seizure free. So I just can't stress enough the message is to be aggressive treating your seizures, seek out treatment at a specialized level 4 epilepsy center. That's where you're going to have teams of people who will have the greatest number of options available that can look at someone's epilepsy in the greatest detail and figure out exactly all the possible things that can be contributing to it and all the possible treatments, surgical and non-surgical, that are available for somebody. It's epilepsy treatment now is not what epilepsy treatment was. It's remarkable. But even people who may have been seen in the past should get reevaluated.
That's so true. It is such a dynamic, iterative process, and you're right. Like, just because something didn't work for a period of time, that doesn't mean it can't be revisited. So I think that's a really great message that I'm going to start making sure that I pass that message along as well, just to keep trying and keep being aggressive, for sure. I just want to thank you both for giving me your time. I know you're both super busy, but you have a great story that I wanted to share, and I wanted to make sure I got that online. So thank you again for being with me, and I look forward to meeting you guys again in person when all of this clears over.
Thanks for getting us together. We never miss an opportunity, Howard and I, to either jaw back and forth or to do so while advocating for better care.
Thank you. We're very lucky. And again, we know so many other people are like this. I mean, Josh, we meet people all the time. Anything that we can do to help others work together, the hospitals, the doctors, the foundation, it's just as Josh, you had said, it's the connection, checking it out, evaluating it again. Someone who went through it, I would definitely, there's more we can all do with each other, help each other.
Awesome. That's a great note to end on. Thank you again for your time tonight.
Thank you.